Thank you, Madam Chairman. Secretary Becerra, I'm going to clear up a social media rumor that you spend most of your time outside of Washington, D.C. Is the majority of your time spent in, the great majority spent in Washington, D.C.?
In many ways, I would say, unfortunately, yes, because I still have a home in California as well. My wife is still in California.
Spend your time here. It's great. Let me turn to another topic. I concurred with Senator Paul, his concern about natural acquired immunity with regards to COVID-19, and I was disappointed in your response. I had expected you either to say one of two things. One, that the science is clear that inoculation adds to one's protection against COVID-19, and that he was wrong about the studies he described. He said every single study said that natural acquired immunity is better than vaccination, or at least as good as. Or I expect you to say, look, maybe it's the same, but we can't determine whether people have had COVID necessarily or not, and therefore we're, out of an abundance of caution, we're insisting they be vaccinated. Could you please get back to the committee with an answer to his question so that we can know where the science stands and where the administration stands? Secretary Cordona, I note that as young families are thinking about having children, they consider the plans for what it will mean to have a child, and they consider about pre-K, about child care, about college expenses down the road. And I note that in the president's plan, the so-called reconciliation bill of $3.5 trillion, that the plan is that child care rather and early learning expire after 6 years instead of 10 years of the full program, that pre-K expires after 7 years, and that community college coverage expires after 5 years. Do you think that young parents should therefore plan on these programs disappearing in 6, 7, and 5 years as proposed under the administration's legislation?
Thank you, Senator Romney, for the question. We're at a point in our country's history where we have the opportunity for transformational change for our students and our families. I
totally agree. I don't want to go on a different topic here, which is the transformation. Is this a permanent change? Or it's transformation, but it's permanent. But if it's just temporary, 5, 6, and 7 years and all these programs go away, that's not transformational. That's bait and switch.
Well, Senator, I do believe at this point the families, especially post-pandemic, providing community college access, that only helps the economy, and that would help.
But should it expire at the end as it is planned now at 5 years?
I'm hopeful, Senator, that today goes really well for our families across the country, and that in the coming years we'll find ways to continue to support those strategies that we know lift American families.
You mean it's your anticipation that these programs then, that parents should count on them continuing?
That is the goal, to have community college access for all families.
If that's the goal for all these programs, not the 5 years, 6 years, and 7 years that's in the legislation, how are you going to pay for it? Because there's only one of two ways: either more debt or higher taxes. Which do you prefer?
Well, Senator, I know that in this proposed budget, no one making under $400,000 will see an increase in taxes. But I will tell you,
well, that's right away. But if you're saying that down the road, when these programs are set to expire, you'd expect them to continue instead, then that means any promises about not raising taxes on people making under $400,000 a day, those are going to expire as well.
As a lifetime educator, I can tell you what's being proposed is transformational for our families.
I agree it's transformational. I'm not sure it's transformational in the right way. I'm concerned, for instance, that we're going to double the child tax credit, which allows people to help pay for child care. At the same time, we're going to give them free pre-K for 2 years. Why double? Why give people free pre-K and double their child tax care credit, which they could use themselves to either decide to care for their own children at home, to go to Head Start, to go to a private child care facility? Why do we have to both double the child tax credit and at the same time provide free pre-K and, by the way, build new school classrooms to do so?
Sir, for me as an educator, early childhood education is a foundation for a strong educational program.
Totally agree, but why do we have to pay for it twice?
I've seen the benefit of it, and I know for many of these families, their ability to get back to work and add to their income is
Look, I'm perfectly happy with providing funding to families so they can provide child care for their child. I think they ought to have the choice of, one, providing it themselves if they want to, either with a family member or a spouse, or number two, sending a child to a child care facility of their choice, but just say you're going to do that, and we're also going to give you public school child care. That's two programs, doubling the cost, and it's taking away the incentive for people that might choose to decide to have the child cared for at home. I think my time is up. I'm sorry, Madam Chairman. Back to you.